Hello, everyone. Thank you so much for joining our webinar series today. Today, we are here with Dr. Sabrina Fabi, and her presentation is Don't Let Your Body Give Away Your Age. So I am very excited. She has a lot of really great tips and pearls and tricks to share with you all. I'm going to give you all a little bit of time to join. And while I do that, I want to make sure everyone's aware. On the bottom of the screen here are hopefully two options for you. One of them is a chat. That is if you need to ask me anything personally or have a question for me or having any trouble. And then there is the Q&A. Hopefully it's over here. That Q&A is where you can populate questions for Dr. Fabi that you would like to ask. You are welcome to start populating those now, or you can do it as she's giving her presentation. And Dr. Fabi will do her best to answer as many of you as she possibly can. So before we get started, I also have a little poll that will help Dr. Fabi understand a little bit more who she's speaking with so she can better present her recommendations. So in about one moment, will be a little poll coming up on your screen. So just one simple question. Do you feel your body looks older than your face? Now you may say, well, my face also looks older than I feel, but let's just see what you say and how you guys feel about this. So please enter your answer and then press submit. And for those of you just joining, there is a poll happening right now. We're just waiting for everyone to get situated, and we will start in about 1 minute. And you have joined our webinar with Dr. Sabrina Fabi, speaking about does your body give away your age? And she is going to be speaking about a multitude of topics, including cellulite, dimples, that inner arm crepiness, chest wrinkles, and buttocks augmentation. So all the latest tips, tricks, and techniques. So all right, get your last answers in here. And I'm gonna end this poll. And let me share these results. So I guess this makes sense since most of you have tuned in. So it seems most of you, yes, you feel like your body looks older than your face. And only a couple of you said no, so maybe you're just here to learn and prepare in advance so that you are ready before you need to get to that place. So with that in mind, thank you so much for responding to the poll, and I am now very excited to turn this over to Dr. Sabrina Fabi. She's an incredibly famous and well-respected dermatologist. She is an expert on all types of cosmetic procedures, from injectables to lasers to body sculpting to veins and anti-aging. But today she is here to speak specifically about a lot of the latest and greatest in body rejuvenation techniques to make sure that your body doesn't give away your age. So up to you, Dr. Fabi.
Hi, everyone. Thank you so much for joining. I am going to be covering some of the modalities that you can do to pretty much make sure that you can keep your body looking as youthful as the face that many of you are investing in. And these are just some of the modalities and things that we offer in our practice. Obviously, there's more, and you're more than welcome to ask those questions through our chat. And so I like this photo of Meryl Streep. Not just because her face is superimposed on Angelina Jolie's body, but the fact is that you can't even tell that her face is superimposed on a 40-year-old's body, because even though she's had a facelift on, you can appreciate that her face matches her neck, which matches her chest, which matches her inner thighs and knees. And so patients are always asking to get a natural looking outcome, but it's not just not being able to perceive the results on the face that you augment. It's also making sure that that face matches the rest of the aged body, especially in Southern California, where many of us like to hike, like to surf, like to row, like to golf, and that body commonly gets neglected and we forget to apply our sunscreen. And so the chest is usually one of the most common areas that I see after the neck that can give away someone's age. I covered the neck at my last webinar on the 5th of April, and that's available on our social media handles if you're interested in going to check those out, as well as on Cosmetic Laser Dermatology's a YouTube channel. And so before I start and go into the chest, Risa is going to be asking everyone a poll question.
Perfect. Okay, so this next poll question should be populated on your screen right now. So do you have chest wrinkles? Yes, you have a lot. Yes, some, or no. And then does your chest bother you? Maybe wrinkles, maybe brown spots, maybe sagging skin. So I'll give you guys 10 more seconds here to complete this, and then we'll share the results with Dr. Fabi. And I just want to remind those of you that joined in later, there is a Q&A function on the bottom of the screen that you're welcome to use throughout Dr. Fabi's presentation or at the end, and she will try and answer as many as she can. Okay, press submit, please, if you haven't. I think I see people changing answers. Okay, so here are the results. Okay.
Very good. And so thank you for those that are answering, because I'd say that the chest after the neck is a common area that gives away our age. And that's because many of us are driving and a lot of that UVA is penetrating through our windshield, believe it or not. At least 50% of it, we actually get into shade. And so the chest usually doesn't get much makeup that's typically mineral based to at least create some level of physical barrier. But also we forget to apply sunblock on our chest. And so the first signs of aging are typically pigmentation. And so we get a little bit of freckling, and then before we know it, it's almost like the background is entirely brown. And on top of it, we have individual freckles. And so this is a patient of mine, and you can see I did an IPL treatment first, and then on top of that, I did a little bit of a Q-switched alexandrite laser to individually target those brown spots. Those brown spots are sometimes more than just a freckle. They're actually what we call seborrheic keratoses, or what some people call liver spots. And so if you just do an IPL, which many people come to the practice and say, I did an IPL, it didn't really work. Well, that's because there's over 40 IPLs on the market. And so we can't realistically believe that a low-powered IPL will ever give you the results that a single high-powered IPL could give you. In our practice, we have the luminous IPL, and so that is one of the most powerful IPLs on the market, and we commonly combined it with a Q-switched alexandrite laser to individually target those seborrheic keratoses, which are almost like growths. Now, of course, if you go to someone who's not a dermatologist, they may not know how to even diagnose those. And so they may not even know how to effectively treat them with a different kind of laser. And so in our practice, we have found that the combination yields a better result than just an IPL. And that's why you can see this patient after a single treatment 3 months later, you get a radical result. With this procedure, it takes 5 minutes using the luminous IPL because we don't need to do multiple passes. Afterward, you will see that all the brown spots get a lot darker, like you've been laying out in the sun, and off. On the face, they shut off in a week. On the chest, they typically shut off over 10 to 14 days. And I always tell patients that you will need 2 treatments on the chest, where on the face, you may just need 1. If you need 2 treatments on the face, then you typically need 3 on the chest, because you can't be as aggressive on the chest. This is another patient. With her, she's a little bit older, wanted a more radical result. So you can see she came in just for these individual brown spots, but there's a background of sun damage. So if you just individually target these brown spots, what I see with my patients is that they end up getting white spots that look a little bit lighter than that background of sun damage. So you really need to treat all of it. And so with her, I elected to do the Fraxel Dual first, and on that same day, again, to treat those individual brown spots that you see, which are growths. They look like freckles, but they're true growths. If you biopsy them, you're able to see a significant improvement, and we actually published this case in the literature. Now, sometimes it's not just pigmentation. You know, sometimes we advance. Pigment is what we start to see in those that are 20, 30 years old. But even in our early 30s, if you've lived in, you know, Southern California, or if you did tanning beds when you were a teenager or 20-year-old, hopefully you're not doing that anymore, you start to see these fine lines and wrinkles. And the lasers commonly cannot get rid of them completely. When they're fine like this, I like to use Ultherapy. And we actually were the ones who did the clinical trial that got this approved. So this is after a single treatment. You can see that those wrinkles are gone 3 months later. And so how does Ultherapy work? Well, historically, this is a device that has an FDA clearance to be utilized on the lower face and neck. And it also has an indication to lift the brow. But the way that it works is the way that it works all over, not just the lower face and neck. It's also how it works on the chest skin, as well as if you use it for the crepiness in the inner thigh, or if you use it for the crepiness underneath the knees. And so Ultherapy was a device, if you can see it right here, for those of you who've had it done, where you apply a transducer. And this is a non-surgical treatment that uses ultrasound energy. And it's very important that you're able to visualize what you're treating. Many people say, well, I've had Ultherapy and it didn't work. Well, if you're having it done by someone who's never taken an anatomy course or a radiology rotation as a doctor, then it's very hard to understand what you're visualizing in order to get the result that you're looking for. And so here, what Ultherapy does is you apply a transducer and it delivers a pulse. Those little circles that are orange are delivering heat at 65 degrees Celsius, which is not a warm massage. And that's the reason why in our office, we give you Pronox to alleviate the heat and sensation that you get. Then with another transducer, we visualize and confirm, and we will treat at 3 millimeters. And then with a third transducer, we may elect to deliver at 1.5 millimeters. That heat will break up the old collagen fibers that are damaged as a function of age. And it tricks your cells called fibroblasts that you see on the screen, which become slower in their ability to reproduce and create new collagen. At the age of 40, it tricks those cells and it revs them up to lay down new collagen. And in a study done in 46 and 48-year-olds, what they found was that it increased your ability to create new collagen by about 40%. And so that's how much new collagen is increased and created. Now, the procedure is done, the injury is done. It takes up to 3 months for you to lay down enough new collagen to get the clinical result. And it even is better 6 months later. And so that it has an indication for the improvement of chest wrinkles. So in a single treatment, you can see in our clinical trial patient, look how severe she was before. She looks better at 90 days, but at 6 months, her wrinkles are pretty much gone. Now, of course, some patients don't want to do Ultherapy, which can offer you the treatment in just a single treatment. Some people elect to do injectables like Sculptra because they've had them done before. So in our office, the nice thing is that I'm able to do any of this. And we've actually been pioneers when it comes to chest wrinkles, from being the first to publish on the use of dilute Sculptra for the chest, to being the first to publish on the use of Ultherapy to the chest. And we will be one of the first to publish on the use of dilute radiesse to the chest. So we utilize all of these modalities. The nice thing with Sculptra is that you're seeing me inject this patient. It takes about 5 minutes at the bedside to do a treatment with Sculptra. But with Sculptra, you need 3 treatments to get the result, where with Ultherapy, you need a single treatment. And this is fast forwarded. I promise I don't abuse my patients like this. With Ultherapy, you need a single treatment, which takes about 20 minutes. So the nice thing in the office is that we can offer you both modalities. In somebody who's more advanced, like this 70-year-old, it took a combination of Ultherapy, Sculptra, and IPL to address her pigment to get these results. And so her chest is completely rejuvenized. And this results last, at minimum 3 years. She's never gonna go back to what she looks like. Now she essentially does a single IPL, an Ultherapy, and Sculptra once a year to maintain her chest looking 20 years younger. And so that's the reason why we have so many modalities in our office, so that we can address the spectrum of conditions that show up. This is another patient. She had severe wrinkles, almost folding over because of how crepey she was. Here she is 3 years after 2 IPLs and Sculptra. So she had no L therapy. So depending on your severity, I will customize the treatment plan for you. And so before we move on to arms, Risa has another question.
Perfect, everyone. So this next poll is going to help Dr. Fabi understand where you are all at with your inner arm crepiness. So Dr. Fabi, for those of us that don't know, can you tell us a little bit what you mean by crepiness?
Crepiness is almost like cigarette-like paper skin that people start to notice along their inner arms. And this is a common complaint of a lot of my patients because they feel self-conscious when they wear a tank top or a dress and they no longer feel comfortable and confident doing so.
Got it. Okay, so I hope now you guys can all tell us, do you have inner arm crepiness? Yes, somewhat, or no? And please answer. It's anonymous. We cannot see who's saying what. It will just help us guide this, help Dr. Fabi guide this presentation. So another 5 seconds. Press submit, please. All right.
Okay, a lot.
Yes.
So it seems like 2/3 of everyone has either chest wrinkles, or in this case, 2/3 of people have inner arm crepiness. Something before I get into why the treatments, the reason that this happens is that you're going to start to see these changes depending on how thin the skin is. So the thinnest skin of the entire body is right underneath the eyes. And that's the reason why that starts to give away our age around our eyes, typically in our 30s. The neck skin is one of the thinnest skins as well. And that's the reason why in our 40s, we start to notice that it becomes a bit crepey. The skin behind on the back of the hands, as well as the skin in the inner arm, probably follow as far as thinnest skin. And so when we start to go into menopause or become perimenopausal, which can happen up to 10 years before you officially lose your period, which is the reason why it's important to see a functional medicine doctor who can check out your hormones and optimize your hormones. You don't want to wait until you've lost all your hormones, because estrogen is a huge driver of new collagen formation. And so if you have the thinnest skin, neck, chest, inner arms, and hands, it's no surprise that these are the areas that start to give away our age. And it's also no surprise that you didn't start off with the reservoir there to be able to tolerate years of sun damage. And then when you go into menopause, now you don't have the cells that are being fed with hormone to lay down new collagen. And so you start to see the discrepancies in these areas the most. So what I tell my patients is, I can do a lot, but your hormones are very powerful too. So it's always important to obviously see a functional medicine doctor. And then also sun protection, pollution, and all these other things contribute to thinning of that skin. And so these are all reasons why it's happening. So this is an area that many people that are perimenopausal start to come in to ask and get questions and get treatment for. When you go into menopause, you lose 30% of your intrinsic ability to create new collagen production. Usually in your 30s, you're losing just 1% with each year of life. So you get a lot of decrease in those first 3 years, which is the reason why you don't even want to go through them if you can. And so if you've already gone through them, not a problem. You're going to see patients of mine who have benefited from treatments. But obviously, if you can start doing these things earlier, when you have the cells that can lay down new collagen, the better, especially in your late 30s, early 40s. And so one of my treatments of choice for the arms I do a lot of teaching worldwide. This was one of my models. You can see this is that crepiness is what I'm talking about. It's like almost cigarette paper-like looking skin. And we see a lot of it in the inner arm because we don't have as much of that thick fascia connecting the skin to the underlying tricep and bicep muscle. And so here you're going to see me momentarily inject dilute radiesse. Dilute radiesse is basically another product that can be used to trick the body to create new collagen. So we've gone through all therapy, we've gone through Sculptra, and now we're going through dilute radiesse. I use all of these modalities in my practice. Actually, in this one, I'm using Sculptra again, but you can use dilute radiesse, and that's actually the product that I use the most now in the inner arm. So again, this is fast forwarded a bit, but it's not painful. The body is not nearly as painful as injecting as the face. We just don't have as many nerve endings. And so it takes me about 5 minutes to do each arm. If you have some crepiness on the back of the arm as well, it may take me about 10 minutes to do each arm. But the nice thing is you can see that there's no bleeding, there's no bruising. And this patient will resume her daily activity. And then you'll see her momentarily. This is after 3 treatments spaced 1 month apart. This is not the same patient, but similar age. And you can appreciate that crepiness is improved. It's not going to get rid of all of it. If you want to get rid of all of it, then really your treatment of choice is a brachioplasty or an arm lift. But the problem with those is that you have a scar that goes from your elbow all the way back, all the way to your armpit. And so those are very hard to conceal. And this is the reason why many patients elect to do non-surgical things for their arms. Same with the chest. There's really nothing surgical that you can do to improve the wrinkles of your chest, which is another reason why non-surgical modalities are so popular. Another treatment that I do a lot of, if this video will work, let's see. Give me a sec, guys. Thank you for your patience. So this is one, but this is another. I do a lot of microneedling, and what I'll do is that I will, if somebody does not have that much crepiness, I will do microneedling, and then I will drop down a little bit of Bellatero dilute into the skin. Bellatero is a hyaluronic acid product that will draw in water. And so you can see me applying it right now and essentially make that skin not look so dry, dried up like it starts to look. And so this is another way. And so that's the reason why we offer many things in our office so that we can address the many different, concerns people have. This is something that I choose to elect to do in somebody who might be a bit younger. And so before we move on to cellulite, Reese, I don't know if you want to ask a poll question.
One more poll question for you guys for the day. And so now it should be up on your screen. So do you have cellulite? I hope no one makes us feel bad because I think almost all of us have some.
Yeah, 90% of women have cellulite. So I'm interested to see what our poll shows.
Okay, well then either we have a lot of young people or very lucky people, or most people will have it. And then have you treated your cellulite?
That's a very important question. I'm really curious.
I know there's lots of different treatment techniques out there, and we're not specifying what, have you tried some cream from Amazon? Have you visited a dermatologist? Have you tried to treat it? All right, submit please. All right. So it seems we met. Oh, let me share. There you go.
Okay, so that's about right. So 95% of people have cellulite, and I completely agree. Interestingly, only 20% have treated it. And so I'm publishing a paper right now on a national-wide survey that was done on 1,200 people all across the country. And very similar results as far as people that have actually embarked on doing treatment. Even though 90% of women have it, many choose not to do treatment because there's not that many treatments that are effective, and many only offer temporary improvement. And so for that reason, in our office, we really only offer things that have at least results to show that it can last about 5 years. Another reason why is because people don't know how to diagnose cellulite. And so cellulite has become an umbrella, all-encompassing term to not only describe dimples, but also skin surface irregularity, stretch marks, skin laxity. And so I'm going to go through this. Out of the entire presentation, this is probably the most thorough part because it's an area that affects so many women, but where there's a lot of misinformation. And so, you know, we have cellulite not just when we're in our 60s, but also when we're born. And that's because this is hormonally mediated. And so we see these babies sometimes that have it, and that's because they still have the influence of their mother's estrogen running through their system. But you can see how someone from the front can look so good, like Sharon Stone. And then when you look at her from the back, you see what appears as cellulite. And so this is a very distressing condition for many women. Now, my favorite treatment for cellulite presently that's FDA cleared is Cellfina. And the thing with Cellfina is that it's not that it doesn't work for everyone, it's just that it's intended to be used for people that just have dimples. So if you are someone that looks like the person in the screen to the left and just have dimples, then you're an excellent candidate for Cellfina. And you can see how after a single treatment, they're significantly improved. The issue is that it's not just always dimples. We start to see that there can be skin laxity sometimes, or you start to see divots from fat loss, which I'll go over in a minute. And so it's not that the cellulite treatments don't work, is that you weren't probably properly diagnosed and all treatment options were not recommended. And so what we commonly see is someone that looks like this. You can see that she has dimples on the left side of her butt. But then when you look at the right side, you see almost like these striations, and you see almost like a divot in what we call the hip dell, the lateral butt cheek. And then you start to see these almost like deep divots into her thighs. And so there's multiple different issues. You've got dimples, you've got skin laxity, you have excess fat, typically of the saddlebag, you have volume loss in that hip dell, and then you have stretch marks. So you have multiple things that are contributing, and it all falls under the umbrella of cellulite. And so that's why it's very important to be assessed by somebody who does this a lot. And so what's an ideal butt? This is what an ideal butt looks like. One that is hairless, one that doesn't have any pigmentation, one that has a beautiful round contour, one that has no dimples, and one that doesn't have those surface irregularities. And so what are your treatment options? There are many. For the excess fat along that saddlebag, you can do something like lipo or CoolSculpting. For the dimples, you can do Cellfina, although there is a new drug that we have been investigating now for the last 8 years that will hopefully get approved this year called CCH. And that's an injectable, which I'll cover briefly. You can also address that volume loss that causes all that waviness in the outer butt cheek with either fat transfer, radius dilute, or Sculptra. And then for the skin laxity, depending on how heavy it is, you can do all therapy, you can do ThermERF, or you can do a laser. So there's a lot of things which just tells you that it's not a simple issue. So this is the typical patient that comes into my office. She's 42. She has dimples. You've seen me circle them, but she also has all those changes in her outer thigh. So in my practice, I always reduce the fat first. With her, I elected to do CoolSculpting first, and you can also do lipo. Either one is fine. I do both in the office. We have a dedicated CoolSculpting room. We have 2 devices so that we cut the treatment time in half. I apply all my own cups, and this is very important because if you have a shift in that cup by at least 1 centimeter, you can get a divot. So this will reduce the fat in that area by about 20 to 30% in a single treatment. On the same day, I then go and I numb all the little dimples, and then I release where that skin is held and bound down to the underlying muscle with this little mouse-looking device that has a blade at the very tip that releases those tethers where that dimple is being created. You can think of it like a mattress pad, where you have the little coils that kind of pull down on the top of that mattress pad. If you release them, that top of that mattress pad will go back up. And that's what a Cellfina is essentially doing. So look at this patient today. What have I done? You can see that I reduced her saddlebag with a little bit of CoolSculpting. And then I improved those dimples with a little bit of Cellfina. And so this has reshaped her butt so effectively that it almost looks like it looks lifted. And that's all because everything that we do is an optical illusion. If you can reduce the fat, and then what we have found is that releasing some of those tethers with Cellfina not just improves dimples, but it repositions the butt a bit. And I'm going to show you some photos. So this is Cellfina essentially. If you have dimples, this is a 44-year-old patient of mine, a single treatment. You can see that I tell my patients 90% of your dimples will be 50% improved. In the trial, 94% of patients still show that improvement at a year, 100% at 5 years. So that's the nice thing with this treatment for those that are looking for a longer term option than some of those treatments that you have to do twice a week for 8 weeks and mesotherapy and all these other modalities that are out there. But again, it's more than just dimples. You can see in this patient, I relaxed her dimples, but look at her butt. It almost looks a bit fuller because when you relax those coils that are making that butt kind of tuck in, it will reposition the fat. So now your butt looks fuller. So I commonly get patients that come in and they want a BBL or they want sculpture to their butt to give them volume. But if you do some Cellfina, you can actually get a nice relaxation of that skin and fat and fill in very nicely without needing any injectables. Just like this patient, all I did on her was Cellfina. So sometimes it's these dimples that are causing those divots. And if you can just relax them, look at how it nicely fills out with her own fat. She didn't need any volume replacement. And so this is how I typically mark. And it's dimples that you can kind of press and then you can see. And then this is the treatment that you see on the right-hand side. It takes about 15 minutes to mark, 15 minutes to numb, and 15 minutes to do the treatment. So you're in the office for 45 minutes. Afterward, you wear a Spanx garment for 1 week. You may have some mild bruising that can last up to 10 days. And if there's any little marks from me going in, I laser at about a month. And you look much better, and as early as a month, looks even better at 3 months, and even better after that at 6 months. Now, there's a new treatment that we've been studying. It's called injectable collagenase Clostridium histolyticum, which is basically a fancy term for CCH. It's an injectable that is derived from bacteria. This is nothing new. Many of our injectables that we utilize, whether it's Botox or whether it's some fillers, are derived from bacteria. And so this is something that we've been investigating. This is something that I've already presented recently at a meeting, and where we injected patients 3 times, spaced 3 to 4 weeks apart, and about 65% of patients noticed an improvement. And so with this, depending on how severe your dimples might be, this might be something that's even easier for some patients to undergo, especially if they have mild dimples. Although we studied this for those that had moderate to severe dimples, this is something that you can easily do at the bedside and takes 5 minutes to do. Just like with any injection, you can get bruising, but it's not as invasive as the other procedure. So that should be coming out hopefully by early next year. So something to look forward to. And so now that's the dimple issue. There's also the skin laxity issue, the waviness issue. And you can see it beautifully on this patient and her inner thigh. It's like this waviness that starts to happen, and it's not just along the buttock or posterior thighs. It can even be along the inner thigh. So I did on her therapy immediately followed by dilute radiesse, and you can see her a month later how much better she looks. This is a 70-year-old patient, so I commonly get the question, well, what if I'm older, it's not going to work? That's not true. It may need more treatments, or I may not necessarily be able to get your thigh to look like a 30-year-old, but a lot of my patients that get these treatments are all the way up until about 75 years of age. The knees, like this patient, she's a 39-year-old with that crepiness, and that's skin laxity. This is not cellulite. You can see her a single treatment 9 months later is significantly improved. This is another patient. This patient thought it was cellulite. This is skin laxity. I would not do Cellfina on a patient like this because she has no dimples. All that waviness is due to volume loss and skin laxity. She's 60 years old. So with her, I did therapy to kind of lift that skin. And on the same day, I did Sculptra immediately after. And you can see her a month later. She doesn't only have more volume that makes her look more youthful, but also it has improved the quality of that skin. This is a 70-year-old. So just to give you the range, again, she has dimples. She has that waviness in her outer thigh and buttock. This is with a combination of therapy and Sculptra. And you can see how much improvement she has in the quality of her skin and that rippling that's due to skin laxity, not dimples. And so there's a lot of different modalities that are out there because there's many different components of what makes up cellulite. Now, there's some patients that are in their 20s, like this patient. She has no dimples. She's pretty much perfect, but they want more volume. So this is a patient 3 months after a single treatment with Sculptra. And so the patients that want more volume in their butt are typically the ones that don't have fat anywhere else in their body to take from. Be very careful with people taking fat for fat transfer if you're extremely thin, because it can leave you with skin irregularities that you end up having to pay the price for later. So your 20-year-old self or your 40-year-old self will be paying the dues of a 20-year-old's decision. So in someone like this, Sculptra is ideal. Typically, I tell my patients they're going to need about 3 sessions spaced about 2 months apart. But you can see how much more rounder and more youthful her buttock looks from just a single session of Sculptra. This is another patient. She's in her 40s. And you can appreciate that her butt not only looks fuller, which makes her look more youthful, but it's a bit more lifted. So with her, I did therapy and Sculptra because she's a little bit older and we were trying to give her a better result. But now her butt's gone from a 40-year-old butt to a 25-year-old butt. And most recently, and I'll be finishing off with this, we introduced Cool Tone into our office because there's a place for volume, lifting and tightening, as well as fat reducing and dimple releasing. But you have one of the largest muscles in your entire body right along your backside, and it's called the gluteus maximus muscle. Many of us make it larger with squats or glutes. And this is excellent because it's also your largest muscle that it increases your metabolism. So if you like to eat like me, I love to eat, and you want to be able to continue eating, it's a great muscle to work out so that you can continue to increase your metabolism and tolerate the foods that you eat. With age, the hormones that allow us to build muscle decrease. So you may notice that you used to work out when you're 20s. If you took a 6-week hiatus, you still had some muscle tone when you went back to the gym. But today, in your 40s or 50s, if you stop working out, in like 2 weeks, you decondition a lot faster. And that's because you don't have the anabolic hormones that keep that muscle tone going. And so as a result, there are companies now that are creating devices to build that muscle to support and pretty much support the workouts that you're already doing. They're by no means a workout substitute, but they essentially will help build up those muscles more than you physiologically can, because we can only do maybe 30 crunches or 100 crunches in one session, but this will cause over 25,000 contractions of a muscle. And so you're able to recruit more muscle fibers so that you can get more of a result. And in addition, how many muscles are recruited are more muscle fibers than if you just did a crunch on your own. And so we have Cool Tone. And so essentially it delivers all this muscle intent, all this stimulation to get all of your muscles at maximal contraction. And it does this by essentially delivering multiple different little contractions over 25,000 in a 30-minute interval. So these are some of the results that we got. You can see that this person, just after 4 treatments, her butt looks like it's projecting a little bit more. In this person, you can see he already started with a decent sized butt, but look at how much bigger and how much more it projects. And it's not just for the buttock, it's also for the abdomen, Somebody who already doesn't have any fat but wants a 12-pack, you can see them, and the results last up to 3 months after the last treatment. And so in this woman, something that we commonly see is if you've had a baby, your transverse abdominis muscle, which is essentially the corset of your abdomen, widens. And the only real different exercises that will really engage that corset so that you don't look like you have this little pouch are a plank or Pilates. And so this Cool Tone device essentially works on this muscle so that it brings it in. And so here she is, no weight change immediately after her 4th treatment. And so essentially in our office, what we do is we do 2 treatments, 1 week, 2 treatments the next week. And the beautiful thing is that you see the results immediately after treatment, and you maintain them for about 3 months after the last treatment. I typically tell my patients to do a maintenance treatment of once every month, just so that you can continue to reap this type of result. Another patient, you can see how much toner everything looks after 4 treatments with Cool Tone. And so this is an excellent device that can also address the issues, because there's a skin issue, there's a fat issue, there's a muscle issue, and we're losing bone. So if you want the best result, addressing every single tissue layer will give you the most comprehensive result. And so with that, I thank you. And we're going to be answering some questions for the next half hour. Risa?
Great. Thank you guys so much. So Dr. Fabi, that was amazing. There was so much information, and I know everyone seemed to enjoy it because there's a lot of questions here for you. So for those of you that haven't asked your questions yet, down here somewhere on your screen, there should be a little Q&A box. Please submit questions as you wish. Here we go. So Dr. Fabi, do you have a laser to remove permanent eyeliner at the end of my eye?
We do. We have multiple different lasers in our practice to remove permanent eyeliner. You have to be very careful though, because eye shields will typically protect the skin, and eye shields will typically protect the eye, but you have to make sure that whoever is doing it is operating with an eye shield. And depending on the color, if there's any white that was placed to create a brown looking color, it could paradoxically get dark before it gets light. So we have over 6 different types of tattoo removal lasers to be able to choose the right one for that.
Great. Okay. This is from Shannon. You mentioned more specific to people in their 30s and 40s. How about someone 53 using therapy to treat wrinkling of the chest?
Oh no, all the photos that I showed for the wrinkling of the chest were actually in their 50s. I would disagree with that. The photos that I showed were people in their 50s. And actually, if you saw the beautiful results of that person with the really deep chest wrinkles, she was 70 years old. So therapy, the average age of most people that need therapy are typically 57 years of age in most of the clinical trials.
Wow. Okay. Here's one from Rebecca. I'm 40. I'm starting to see some in my arms and legs seem to look like an old lady, or my arms and knees. Up from there on my inner thigh, I have some bad backs of the legs. I have been using a fascia blaster. What would you recommend?
Fascia blaster I'm not aware of any clinical trials that have shown that it gives you any long-term result. There is a lot of trauma with the fascia blaster, and so as with anything that creates a lot of trauma, there will be some tissue swelling, and that tissue swelling can absolutely help in temporarily improving the appearance of a dimple or making the skin look a little bit smoother because there's a bit of minor swelling, but it will not, from any trial that I've ever seen, has been shown to give a long-term clinical benefit.
Okay, great. All right, so this is from Sandra. Can some of the procedures for cellulite also be used for the inner thighs?
So again, cellulite is an all-encompassing term. For dimples, I would not use anything in the inner thigh. Typically what we see in the inner thigh, as you saw in my photos, is skin laxity that participates in creating the appearance of cellulite. Most of the time what we find is those that are 30 years of age or older typically have some level of skin laxity or waviness caused by skin laxity that contributes to the appearance of their cellulite. For this reason, I use something like therapy to tighten and lift that skin. And depending on how severe, I may even combine it with a biostimulator like Radiestolute or Sculptra.
Great. Okay. Here's one from Marty. Do you use thermage for chest wrinkles?
There's no clinical trial utilizing thermage for chest wrinkles that I am aware of.
Okay. Let's see. Is there a certain part of the body that Cool Tone works best on?
In the trials that we've seen, people have a great result historically on the abdomen for whatever reason. Patients report greater satisfaction on the abdomen from the trial that we've participated in. And patients did show a great result in the buttock, but in the trial, 3/4 of the patients were treated in the abdomen, 1/4 in the buttock. So it may have just the power in the trial to really show the improvement. But we've seen more patients happier with their abdomen. And again, it's probably because you can see your abdomen more regularly in a mirror than your buttock. It takes the right mirror and the right angle.
Okay. So let's see. This person says, I'm 60. Can exercise to build up muscle in my arm help with the crepiness if I have muscle loss?
Again, with it may create a little bit of volume to tent on that skin, but depending on how severe that crepiness is, there's also just a function of the skin getting thinner with age, especially when we're in our 60s, we're already in menopause, so that skin is significantly thinner. So you may see some improvement from muscle building, but there's probably a need for something to stimulate that collagen.
Okay. This is from Laura. How long does radius last in the arms?
There hasn't been a long-term clinical trial to examine its effects on the arms. The only trial that I'm aware of following patients out a year on the body was the one that we participated in, where we injected patients 3 times, once every 6 weeks for chest wrinkles. And we found that at a year, patients actually had even greater improvement in their chest wrinkles than at 6 months after the last treatment. So we know at least a year.
Great. Okay. Let's see. Do you treat droopy belly button?
Yes, that's another area where commonly we see some level of laxity. And in those cases, I typically do a combination of either therapy and Thermi-RF, immediately followed by a biostimulator like Sculptra or Dilute Radiesse, depending on how droopy that skin may be.
Do you do BBL, and what are your thoughts on it?
I do IPL by Luminous.
Let's see. Are you doing virtual consults at this time? And I'd love to get on your schedule from Rebecca.
Thank you so much. Yeah, so you can message me if you'd like directly at Sabrina Fabi on Instagram if you're on Instagram. If not, you can put your information in the chat and Risa will transfer your information to our office to set up a virtual consultation.
Yeah, and definitely we please keep up with us on social media, and we will be updating you as soon as we're fully open. But for now, on our website, you can schedule virtual consults, you can call us, and definitely get on the books. I think, we have openings on Dr. Fabi's schedule when we hope to be open next week. Let's see. Do you have a procedure that will help with extra falling skin on the upper lid, or is surgery the only thing that can help me? Lucky me, I inherited it from my dad and I'm 52. So
the skin, remember I had mentioned the reason why you're seeing that in your skin around your eyes is because your reservoir wasn't that great to begin with, because it's the thinnest skin of the entire body. And so we'll always see the changes first around the eyes. If your brow is participating in that heaviness, something I like to do is therapy to the brows, because it is the only device that has an FDA clearance for a non-surgical brow lift. And then on the same day, I do fully ablative CO2 around the eyes. We have seen, and it has been published, that you can get up to a 40% contraction of the skin around the eyes. So no, surgery is not the only option. You can actually get very nice results in about a 2 mm contraction of the skin within the lid with that.
Okay. How about M-Sculpt for some of the leg issues that you spoke about?
Well, if it's a skin crepiness issue, I am not aware that M-Sculpt has been found to stimulate collagen. That is a device that uses electromagnetic stimulation to stimulate muscle contraction. I can't comment its ability to do anything for the skin.
Okay. How often are the sculpture injections needed in the buttocks to maintain results?
So Sculptra is a treatment that if you want volume, you do more sessions. You don't do a lot of volume in one session. And that's something that is being done all over the United States. And if you historically look at how Sculptra has been applied, it's always been, if you want more results, you do more sessions. So once you've actually achieved the volume that you like, which in most cases, it's typically about 3 sessions spaced 6 to 8 weeks apart, then to maintain that result, I typically tell my patients to come in once a year thereafter.
And then another treatment duration. Virginia says, you mentioned 3 treatments for radius for arm crepey skin. How many months apart are those treatments?
I typically will do them anywhere between 4 to 8 weeks.
Okay. What can you do for neck wrinkles and how long does it last?
Depends. If the wrinkles are being caused by a more profound level of laxity, I may do filler along the jawline. I might do neuromodulators to the neck. I might do all therapy to lift that skin. If it's very superficial, like cigarette-like paper, I might do a fractionated CO2 like the Fraxel Repair. So a great resource to learn more about the neck is to check out my webinar that I did on April 5th. That is presently in our archives on YouTube so that you can learn more about options for the neck.
Okay, and let's see. A lot of questions here about when we are opening and that you'd like to come in and see Dr. Fabi. So that is amazing and we would love to get you in. I'd like to encourage you all to call our office right now. Let's have you speak with them on the phone and they can get you on the schedule. We can definitely get you scheduled today for, whenever it might be.
So I'm seeing virtual consultations right now. And again, you can see my handle on the screen if you want to reach out to me. Otherwise, the office phone number is area code 858-657-1002. Again, 858-657-1002, or you can reach out to me directly on Instagram and I will respond, or Facebook.
Great. All right. Thank you so much. So I think, most of the questions more related around your when we will be back open. And then some people have questions about cost. I think with cost, it's best if you can have a virtual or in-person consultation with Dr. Fabi so she can give you a specific treatment plan and quote. And otherwise, I really appreciate everyone tuning in today. We had a really great exposure today and reached, and I really hope you all enjoyed Dr. Fabi's session so much. This will be recorded and placed online, so you will have access to it. We will be emailing it out to everyone this weekend. And like Dr. Fabi said, you can access all of the past webinars, including Dr. Fabi's, on our website, on our video page, on their corresponding procedure pages, definitely also on Facebook and on YouTube.
Awesome. Thank you everyone for joining. I appreciate your attention and I appreciate your participation. And I truly look forward to hopefully meeting some of you in person, and to all my patients that are already established, to seeing all of you again shortly. I miss you all. Bye everyone.
Thank you so much, Dr. Fabi. Bye guys.